Welcome to CareOptions, provided to you by GoldenCare. How to generate leads and attract more prospects. What I'm going to show you today is the operational side of CareOptions, what it provides for your clients and prospects, and samples on how it works. I can't go through everything. Obviously, we'd be here for over an hour because it's got everything one needs for health and wellness, information and resources, and advisory for medical conditions. But let me just go through and review some of the things that will help your clients with. First of all, it's a consumer-driven care planning tool for wellness, disability, illness, caregiving, elder care. And it'll help you generate leads, open new doors, close sales, differentiate your services from the competition, all while providing a valuable benefit to your clients and prospects. This new program addresses 21st century challenges, as I'm sure you're well aware of. Planning and paying for services to help adults care for themselves or loved ones when they become ill, disabled, or elderly in need of long-term care. CareOptions is the first ever online wellness and care advisor that makes house calls 24/7. The system is the only consumer-directed care planning available today that combines interactive assessment care planning, cost projection tools with a knowledge base of more than 2.5 million care resource records. In addition, members can automatically prepare important document sets and store them in their own encrypted file cabinet. The Care Option program underscores the importance of any type of product or service you offer by providing solutions to issues related to financial security and personal well-being to your customers, prospects, even associations and employer groups. The knowledge base is extensive. Physicians, hospitals, clinics, care facilities, assisted living, in-home care, homemaker, and other services such as pet sitting and resources to help cope with many and varied challenges of living. You can create advanced directives, document sets specific to your state, create healthcare power of attorney, create a caregiver agreement between family members, create a care alert medical emergency notification, interactive, functional, home safety, cognitive, and other assessments. And the newest feature, which is coming soon, is the quick reminder system, which allows the user, your members, your prospects, your customers, to set up text messages in their CareOption system to remind a family member or themselves of important times or dates, for medication reminder during the day, every day, or an anniversary or a doctor's appointment, many different things. And that'll be coming soon. We'll have more information for you. Cost evaluators evaluate financial risk if you cannot work or you have to reduce a schedule because a family member becomes disabled and you got to help, or you become disabled or care for somebody else. Project the cost of care in a facility, assisted living, at-home care, so people understand how much money they'd need in savings or insurance to protect their assets against the cost of long-term care. The system is all interactive. It was developed by our professional care managers. It guides users through a step-by-step process that creates a comprehensive resource care plan, providing solutions for their own or their loved ones' care resource needs. The system can be used on many services that your customers and prospects need and want, unlike other programs that keep a portion of the discounted negotiated fee with care providers. CareOptions Online will help walk your customers and prospects through the process of obtaining the lowest possible cost for the services they need on their own. Added appeal for your product offerings. The best way to offer CareOptions is as a value-added service that you'd provide to all your customers, even your prospects. The CareOptions Family Healthcare Advisory Program appeals strongly to individuals, groups, associations, because its value will be recognized and appreciated. One of the best features of CareOptions solution is its applicability to a variety of sales and marketing strategies. CareOptions can add value to any type of product or service. The technology is able to meet the needs of individual consumers and their family members, along with sponsors, advisors, and agents serving the needs of their customers. The powerful marketing tool starts with a simple name and an email address. All of the information is also helpful and can be kept in the system. Once you fill out this card or get it to GoldenCare in some other form, they'll be registered. And the process is simple. As soon as they're registered, a letter goes out, and I'll put that up on the screen for you here. A letter goes out to your prospects, and this letter is automatically generated by the system. It's from you, not necessarily from your direct email address, but the system produces it, and it invites them to CareOptions, and it explains the benefit you're providing to them. And again, your information is on everything. In this case, we're using Jim Smith as the rep, and we refer to that as the sponsor. Your email and your phone number. So your clients and prospects will know who this is coming from, and it's also good to let them know ahead of time that they'll be getting this gift, this benefit from you. Once a month after they're registered, and they have their access code, and it'll show them how to go online, and then it'll give them their access code that they enter in. Each month thereafter, not only them using the system will they see your information, your contact information, your name, but also they'll get another letter. And these e-letters go out once a month highlighting one of the benefits in the system, one of what we call the apps. In this case, this went out last month, and this was a letter telling them about a feature on their CareOptions system that you provided them, about how to see if they took some time off from work or had to care for somebody, how much that would affect them in lost income, out-of-pocket expenses, in the short run and in the long run when they retire. And again, these go out once a month. Every month there's a new topic, a new feature. They give them a way to log on, and then of course click here, or just go in and enter your access code, and then you'll just be directed towards the feature. Now I'll go right into the CareOptions system that you'll see. This is what they see when they first log on to cool.net. They enter in their access code that you saw in the welcome letter and the follow-up letters that they get each and every month from you. They just log in, and they're right at their launch pad. And the launch pad has applications, as we've been referring to, and it really profiles an iPad that a lot of people are used to, and they can move the apps around and reposition them however they like on the whole system. And you got care planning tools, care resources, care cost and income evaluation, important health and wellness assessments, health and medical education advisors, and then an app store, and I'll show you that in a minute, with talking about moving. You can't move an app out of its section, but you can rearrange within each section. When your customer logs back on, obviously they're going to see your name, your address, or your name, your email address, and your phone number. The feature that we talked about is right in the left-hand corner, and all they have to do is click on it, and it'll actually take them to the feature. By the way, you can have your picture added to your profile on this, so your picture shows up on the second page inside the CareOptions system. If you like that, or if you've got a small logo that would be the same size as that picture, you could put that in there also instead of your face. So this is how you go from one app to another. You either click the feature, or you go in. If I want to create a living will, then I go to my file cabinet. I create a file cabinet. I've created that, so you just go on, and I can log into my file cabinet, and I can see if my advanced directives are in there, or if I'm going to continue and make one. I've made one here. I just walk through, next step, answer the questions, put any details in. Also, I can put emails. to direct this as soon as I finish to go to my relatives or my loved ones or my doctor who's going to maintain this particular advance directive. Then I'll also note in here where the executed copy is. The form will automatically show you how to execute it properly in your state. Then all you do is hit finish, and what it does is it generates a PDF advance directive. I can review it, but it's automatically stored in your file cabinet. So it's real simple, it's really slick, and it's specific to your state, which is real important. Okay, if we go out of here and we get back to our program, and let me just go up to the top, return to the apps, and we've got home safety assessment, we got health and wellness, we got hospitals and clinics, and I'll just show you some of the information there. Let me just log out of my file cabinet here for a minute, which I should have done before. Okay, and let me go to hospitals and clinics, and I'm just going to put a zip 53719, and I'm going to search hospitals. It's searching now, and we provide very unique information. You can look at it if it's got a check mark next to the survey indicator. It means it's got survey results. Also, we give you hospital-acquired conditions. You're not really going to find that anywhere else unless you dig on the internet for it. What that is a new measurement, and I'm going to pull this hospital up, that tells you how this hospital grades in terms of conditions and diseases you didn't have going in but you got coming out. And that's a very important one. Everything's explained here. If it's Medicare, Medicaid eligible, what type of beds it has in different units, are there any swing beds for long-term care, a little bit of demographic, then the hospital acquired condition, and this one's got a 7.30 out of 10 rating, and it's really important to read that over so you get an idea of what that means. Also, we do a general cost information here that can be helpful for comparing other hospitals. That's always a tough one because not all procedures are the same, but it might give you an idea of what hospital's very expensive versus another for a specific condition. Patient surveys, this is where you're going to find out if it's a good hospital for your loved one or yourself or not so good. And it's very thorough. And the things that are more important to you are the things you go to and review. So I could spend more time on this. This is something you can go in and research and get acquainted with. Okay, let me go down. Physician services, we have care facilities. You know, if you're looking at nursing homes, for example, or home health care, again, I'll put in the zip 53719 that I used before, 10-mile radius, and I'll just look at nursing homes for this example. All of this is in our knowledge base, in our database. None of this takes you out on the internet to search. It's all in one place. That's what makes it very unique. We give you a couple of different ratings here. We give you the one Medicare rates them with the star ratings, but we also give you additional rating to go by. So inside, what we're going to do is give you the overall rating from Medicare, Medicaid, and then, or CMS actually does it. What we're going to do is give you our methodology, range of comparative quality, based on total number of deficiencies. And again, that's a good one. Let me just go down. You can also look at fire inspections, the records, health inspections, if I wanted to see them all. So everything's here for you to check, including the staff hours per resident, which again is a good one. Then some of the patients and how they benefited at this facility, depending on what they were there for. And again, it's really powerful information, and it's the place your clients, your customers would start as they go in their search for care or a hospital. It's not the only place, but because they want to go out and do a physical inspection. But it'll really give them information they need. Cost of care, something I know a lot of you use quite often. You can use it, certainly, and your clients can use it. And I entered in 53719, and I've got the information, and it goes right down to the cost of care calculator. I can put these numbers in. I can change the length of time for a particular care, and obviously it'll change the scenario. I can project it out for years. I can change the rate of inflation. So that is something I know that you're going to use often. If we go down, we have assessments: diabetes, cancer, depression. These are all valuable. Medical resource library. Information, it's real quick. It's not like some of the online services that get real crowded with ads, and half the time you don't know if you're reading an ad or you're reading about the medical information. So let me just go back to the Launchpad. There's a couple of videos here, whether you're working age adult or mature adult, that they can look at. What's new? It'll tell you about the newest apps. System user guide, real important. It's a good way to get familiar with the system. And one thing I didn't mention, the App Store. If you just click there, it'll take you right down, and you can actually add apps that are of interest to you specifically to your Launchpad. And they'll be there when you log on, or when your client logs back on with their access code, access password. And all they have to do is click on them. A lot of these also will take them outside. For example, healthcare.gov, if they want that handy. And if they want to clean it up, they can always put them back. There's no charge for the app stores. And we add things periodically to it that seem of interest or useful in a health and wellness area. Then you just close it, and those apps obviously are in your system. Real simple. Another thing is this gear. You click on the gear and you get your user settings. Your client or prospect, if they want to change their email, have them click on the gear. They can go in. It's real important to have that update email. So have them put that in, and they can feel free to put the rest of their demographic info in, and it does help us determine the demographics. If they scroll, there'll be a membership card here. They can print out, cut out your name and phone numbers on everything, just like it is on this membership card. So we recommend explaining that to them, to go in, click on the gear, print out that membership card, and keep it handy. It gives them their access code to get in, cool.net, and their access code. So it's very easy to use, very quick, simple, and I know I didn't cover a whole lot with you yet, but these are things that you're going to want to walk through and find out on your own. Again, if we can be of any help, give you training on the use of it in any way, please contact us or contact your regional director at GoldenCare USA. Thank you very much.